Hi there, everyone. This is Amy. I just wanted to make an announcement so that those out there who might be interested are aware of a retreat that I'm so excited about. I am joined by doctors Laura McIsaac and Rachel Mash, two wonderful, wonderful colleagues, GYNs of their own training, who are going to help me teach women about the art of pausing, specifically midlife health and pleasure. This is taking place on June 28th to the 30th, and it's happening at Isabella Rossellini's farm called Mama Farm out in Long Island. So please, please consider joining us. There's going to be massage offered and free time and meditation and breath work. Some acupuncture is going to be offered. So there's all this delicious opportunity to take care of yourself and nourish yourself, as well as learn about the perimenopause and menopause from three gynecologists who all feel really strongly about teaching and empathically, graciously offering all that we know. So please, if you're interested, email info@mamafarm.us. So info@mamafarm.us to reserve a spot and to learn more about it. Please, we'd love to see you there. Welcome, GynoCurious listeners. I'm your host, Dr. Amy Novat. From both sides of the speculum, we will explore what it means to be a healer and to be healed. So please, if you like what you hear today or on any of the episodes, follow, subscribe, share the show, and feel free to send us your comments to comments@radiofreerhiniecliff.org or GynoCurious.com, or call us at 845-307-7446. Today, I am so pleased and grateful to welcome Jenna Smith and Katie Guernsey to the show today. Both these women I've known for a while now. They are both practicing midwives, and their practices include gynecological care as well as full spectrum obstetrical care and birthing care. Both of these women, I also want to remind our audience, are moms. So they have been weaving the very busy professional life of caring for women with their own lives of parenting and figuring all that out. So welcome, Jenna and Katie. Thank you for being here.
Thank you, Amy. It's great to be here.
Thank you, Amy.
So it's three of us in the studio today speaking, although Jen is here too, so she may want to pipe in at one point or another. So bear with us as we figure out this tempo. So the reason that I wanted you here today was selfish. I wanted to see your beautiful faces. And I wanted to share this experience of podcasting with you. And I wanted to be able to, if you will, kind of continue the tradition of sharing birthing stories with each other. And that part of the reason I think that we share our birthing stories is, well, it's multifold. It's to kind of relive and cherish those amazing moments, to heal and mourn, because for some of us, birthing experiences are extremely hard and sometimes tragic, and to kind of just help each other, to teach each other about what the experience might bring. And, it's part of what GynoCurious is all about. My hope for GynoCurious is that storytelling is a way in which us women have always shared our life experiences with each other and taught each other. And so my hope for this morning is that we can share our stories about our birthing experiences, but also talk about how that informed us as clinicians, or how us as clinicians inform the way we experience our own birth. So this kind of, again, this both sides of the speculum approach, which is a very special perspective, at least for me. And so I wanted to talk about that. And, remember that birthing experiences for all of us is such an intimate journey. So we're here to share whatever is comfortable for us. But know that I think any morsels that we can share with our audience, women who feel so isolated about what happened to them, women who are having questions about how to look forward to it, just there's so many questions. that's what we're here to try to explore and share. Okay?
Yeah, sounds great.
Great.
Good. I guess I want to hear from both of you just kind of about the arc. Like, why midwives, and when did that happen in relationship to having your own children? So, Katie, I'm going to start with you because I'm looking at you at the moment.
Wonderful. I'm happy to start. My mom was a midwife.
Oh.
And we lived in a small rural community, and many of her friends were in women's health, the childbirth instructors and lactation support. And so even just right in my neighborhood, many of the families nearby had a culture of women's health and childbirth just around us as we grew up. And so I had that sort of in me as I move forward with my life, and I was always interested in it. My mom had a difficult path to becoming and being respected as a midwife. She was very intelligent, very caring, and certainly achieved above and beyond academically what anyone would need to do to become a midwife. It was a second career for her, and she went back to school when we were kids. And she had a really hard time with respect when she went to find a job locally. People were not kind, and she just really struggled with not being treated well in the workplace. And that definitely is something that I held with me as I moved on in my life and thought about a career. She did find ways ultimately to be a wonderful midwife and care for people, but that was a really tough part, and that there's a lot of judgment and bias still today toward midwives, and it really varies depending on where you are geographically. I had that awareness of midwifery. A lot of people don't know much about midwives at all as a kid, but I did, so that was really lucky for me and definitely an inspiration. And then as I went on in life and tried different things after graduating college and was in social work for a while and worked with animal therapy, I decided that I did want to be a midwife, but it was after I had kids that I ended up going back to school.
So interesting. Okay.
But there's another major inspiration for me. I had the very, very, very good fortune of having wonderful, supportive, and guiding women around me for my first pregnancy, and my daughter was breech. And so I went through all of the research and talked to many people, and was encouraged to talk to someone who's considered an expert in vaginal breech birth, and that was Ina Mae Gaskin at the farm in Summertown, Tennessee. So I went there, and
is she a midwife?
Yes, she's a midwife. And I went there and ended up staying and having my baby there with her, and it was a wonderful, really wonderful birth experience. Again, that was a big inspiration. There's a whole group of midwives there, and their care is extremely unique. When I was there, there might have been 5 or 6 midwives, and they all live in a community there. And I stayed at a house there, which is where I had my daughter. And you don't necessarily have like an appointment at the birth center there. They just sort of see you, walking around or at the pond, and they have their blood pressure cuff with them, and you're chatting, and before you know it, you're having your blood pressure taken. But they really see you in like day-to-day activities, and so that was another huge inspiration for me. So I sort of held it within me for a long time that that's what I wanted to do, and I knew that I would, even though I already had a bachelor's and a master's, I had some extra courses that I would need to take, and I had to make the choice of going to nursing school or not. Before going to midwifery school. So it was a long process to go back to school for it, but I did, and I've been really fortunate to have really good opportunities to work as a midwife since that time.
Great. Thank you. Thank you. I have some follow-up questions, but I'm going to hear first from Jenna about her arc, and then we'll go from there. Okay.
Hi. So before I became a midwife, I was a dancer and danced in New York City. And started
what
doing
kind of dance?
Modern dance, all different kinds.
Okay.
I won't bore you with the list, but that was my first love. Mm-hmm. And then I started doing massage and studying homeopathy. Studied that for years, and acupuncture and shiatsu. I was really into the healing arts while I was dancing, and I was also waiting on tables. Mm-hmm. And one day, I had a moment where I realized I need to do more. I need to give back in a different way. I talked to my mom about it and I said, I feel like I need to give back to the world. And she said, well, when you're an artist, you are giving back. And I really took that in, and I loved that idea, but it's still, I felt like I needed to do something more direct that would help people in a more hands-on kind of way. So I thought, I want to go into women's health. I want to help women. I was driving up in the Berkshires, which I think is actually where I grew up. And I literally had an aha moment. Like, it felt very like the angels opened up the sky and, you know,
I love those
sang,
moments.
You must be a midwife. And it was really just a unexpected, out of the blue. I mean, I had been pondering it, but
Sure.
that moment just sort of came to me.
This is exactly why I ask women the guests in the show to talk about these arcs, because I love hearing about these aha moments. So keep going. The
it
angels
was so
spoke to you.
clear. It felt like a direct connect with the divine.
Yeah.
And so then from there, I just started looking through, how do I do this? I have a background as an artist. I went to Bard College. Was expected to be an artist as an adult. Just how do I do this? And I just figured it out, started taking my science classes and went to NYU nursing school. And I wasn't interested in particularly being a nurse, but I had to be a nurse to become a midwife. So I was committed to that. That was an incredible experience. But partway through, I learned about a program at Downstate. So
In Brooklyn.
yes, SUNY Downstate. And they had a long-standing midwifery program there. At the moment I found out about it, well, let me back up a little bit. I made friends with someone in nursing school, and she was really didn't want to be a nurse, but was powering through and was complaining about it in the elevator on campus. She said, I hate everything about this except the obstetrics part. And the director of the midwifery program at NYU said, she was in the elevator with her, just coincidentally, said, I want you to hear about this program at SUNY Downstate. They just got approval for accepting people who are not nurses into their program. It was legally approved years before, but there were no programs that accepted non-nurses, if you will. And my friend came running to me and said, we got to do this. So we both applied and had a rigorous interview process because it was the first time and they needed to let us know that we would be in a fishbowl for our whole careers. We were the first of this kind of CMs, certified midwives, as opposed to CNMs. And we were both just so excited about it. We both were admitted and then left NYU before as really just one class that I had left to do at NYU to become a nurse. I know. I was that driven to become a midwife that it just felt like I almost felt like I didn't have a choice. Like it's just the world presented this to me. And it was an incredible experience. Boy, did it blow my mind.
Yeah, particularly, working at Downstate, it's such a busy community hospital. I mean, it's a city hospital, but it's the community hospital. And I know from others who have trained there, it's just the diversity and opportunity for both acute and chronic issues is just vast.
Oh, yeah.
Vast.
And we were placed in, North Central Bronx hospitals, Metropolitan. We had an incredible, array of experience. So that's how it went. In that class, there were nurses and non-nurses. It was an interesting time together to be accepted.
Yeah.
And I was definitely the only one who had a completely science-free background.
Yeah.
And it was beautiful.
Great.
And challenging. Yeah.
Great. Well, I'd like to suggest that you remain an artist and that the artistry of your care is not insignificant, and that what sets both of you apart in the work that you do, because I've seen it. I've just seen it, and I bear witness to it, is that you both bring a beauty and respect and creativity to the work that you do that not all of our peers do. but that you do. So thank you both for the work that you do. Yeah.
Thank you for saying that.
Thank you.
You know, it's so, I don't know how many times I've said this on the show, but I'm going to say it again. You know, we have this history of women healers. I mean, that goes back a long, long, long time. I mean, maybe since the start of time, you know, that women have been taking care of others. I don't know why it's in our genetics, but it is. You know, it's obviously related to the fact that we birth the next generation, and there's something obviously about that that's about taking care of. But it still grinds my teeth when I think about women who have been midwives in, you know, years and years ago, and to hear the tumult and challenges that your mom, Katie, had to go through, knowing the challenges that midwives today even still have trouble getting respect, finding support, all the obstacles around CMs, CNMs. I mean, you know, all these degrees that are just ways of creating schisms in people and in communities. So can we just talk about that arc? Because, you know, like Katie, did you experience some of the same prejudice that your mom experienced, or had it, you know, and these things are trends, of course, too, and geographically, right? I mean, there are places in this country that wholeheartedly support midwifery, and then there are other parts that don't. So can we explore that a little bit, please, ladies?
Sure. I do experience it, but not nearly to the extent that my mom did. But I want to give one example that has always stood out for me. I had 4 births, and the birth of my 3rd child, I was planning a home birth, and I had a wonderful midwife, and this was in Florida. And the politics of midwifery there have always been very challenging. I would say one of the harder states for licensing and for general acceptance and respect. And so this midwife had been practicing for a long time, very experienced, very good. And part of her criteria for home birth was if you happen to go into labor before 37 weeks, that she recommended that you go to the hospital and she would go with you. So I was just one day before 37 weeks.
I tell ya, these numbers, they can be really hard in the world of obstetrics.
And I knew when I talked to her on the phone, our hearts kind of sank because we knew that's what it meant. But we were ready to go and make the most of it. And so I got there, and I had a very, very straightforward and good birth there. The experience was not so good, but she came with me, and she was immediately treated very badly. She was questioned and interrogated and almost not allowed to be with me, and then was put in a chair in the corner of the room, like the far dark corner of the room, and was glared at if she tried to speak to me or say anything. It was really a punishment, and it was really very uncomfortable and difficult. And that birth experience was not good for me, even though I was having a very normal labor and birth, and did have a very normal labor and birth, and my son was great. But every step of the way there was tension, and she, I think, was trying to judge whether maybe she should just leave, maybe her just being there. But even just the fact that I had planned a home birth and was there and had anything to do with midwifery was making everybody on the unit angry and defensive. And I was definitely very mistreated while I was there.
I want to point out to the audience that both these ladies work in a hospital setting, in a birthing center, but a hospital setting. So it's not, I want to make sure everyone realizes that I actually don't know whether either of you do home births at this point in your careers. Do you?
No.
No.
Yeah.
I had a home birth, but I didn't.
Yeah.
I've never been a provider at a home birth.
So these are practitioners who have seen kind of an array of clinical settings, if you will, whether it's in the home, whether it's at the farm down in Tennessee, or major hospitals, etc. So again, that breadth of experience and exposure is so important, because as we hone in on our disappointments or frustrations or critiques of the medical system as it is, all of us have kind of seen this array. And I think that's important. When you have perspectives, it's helpful when you've seen a lot of perspectives, right? So it is, it astonishes me that there wasn't room to support your midwife. And it's just another form of misogyny, isn't it? I wonder if the midwife had been a penis haver, would that same hierarchy have been as obvious? I don't know, because I speak about my own, the challenges I met as a female resident during my OB/GYN training and the hardships I received. And I was a MD, I had the right criteria, but yet still my gender was a problem. Yeah.
Yeah, there is definitely a high degree of gender dominance in our profession.
Yeah. So you mentioned Florida being a difficult state, at least then. Can you guys speak to, how is New York as a home for midwives and for women who choose to have midwives as part of their birth experience?
Well, okay, I'll get started. New York is actually was one of the first states to recognize CM, so certified midwives, alongside CNM, certified nurse midwives, on a very equal and level playing field. So
Right.
Same exams, education is a little bit different. Some of the sort of like the essential courses from nursing school are part of the curriculum for a CM student, which Jenna could speak more to. But so anyway, in that way, New York has been a real leader and supporter. But it's taken a lot of hard work on the part of midwives and women's health advocates to get to that point.
Yeah.
And there are still many challenges, but I would say overall, it is a little bit more progressive.
Yeah, I think it's on the forefront in that way. I will say that while technically CMs are equal to CNMs, I still sometimes have some judgment, prejudice, because I'm a CM, which is very interesting to me. Unlike Katie, I went in to the profession very naive, which I think has served me, honestly.
A little naivete can be very helpful sometimes.
Yeah, I didn't understand the dynamics. I just went into it completely kind of open-hearted without any, not that you were not open-hearted, my dear, but
Understood.
but just kind of naive. We'll just stick with that word.
Yeah.
And met with a lot of resistance, a lot of judgment, a lot of anger from nurses who didn't like that I wasn't a nurse. And I was proud of it, and I was surprised, and to this day it will come up once in a while, and it doesn't, I think it's unfortunate, but it doesn't bother me. I think it is, people have their ideas of what it means.
Right.
And New York State, yes, technically, absolutely very supportive. I felt very supported in my school throughout that process. One other thing I wanted to say is that one thing I learned fairly quickly is that to be a midwife is to be political. And I wasn't ready for that either.
All right, you got to talk about that. You've got to talk about it.
Because of the history of midwifery, we have to fight for what's ours. We have to fight for women. We have to stand up against, the male patriarchy, if you will. It's exhausting. And it's beautiful.
Yeah.
And it's relentless. And it's getting better and worse simultaneously.
Isn't that true? Oh, I know.
So it's ongoing.
Yeah.
So for any of you out there who want to become a midwife, be ready.
Yeah, there's a certain amount of, fists in the air, and I'm demonstrating that. And of course, you can't see me out there, but there's a certain amount of advocacy that just is ongoing every day, important to speak out loud about. And again, that's one of the reasons I'm doing GynoCurious, is because the platforms upon which we as individuals in a small community can speak out loud, but it's not a huge platform. And so my hope is that with GynoCurious, it reaches, in the nether regions, and where there might be women out there who are in their early pregnancies and they're like, gosh, I've heard about this midwife thing. I hear that there are people who could perhaps support me in a way that my doctor can't, I wonder what that might look like. And I want them to know about you guys. I want you, because unfortunately, maybe they don't exist in their community, because we know there's medical deserts, even in New York State. And we certainly know there are places, there are hospitals. I don't know about New York. I would like you to answer this. Are there hospitals even in New York that don't have midwives?
Definitely.
Mm-hmm.
Yes, there are.
Yeah. So it's not as if everybody has access to the wonderful support that you give. So yeah, politics. Whew, is that a part of our everyday lives if we're talking about women's health? And you're right. We are at a time, so poignantly, where women's bodies, women's eggs, women's choice are all being discussed, shifted, reversed, promoted. I mean, it's just
Co-opted.
Yes. Yes. Yeah. So, so again, for those of you out there, as best as you can, choose who's with you in your birthing suite, ask questions. Because one of the things I've observed as an obstetrician, former obstetrician, I haven't delivered a baby in a long time, is what midwives can do so beautifully is be present and be in relationship with you and your family in a way that physicians often can't be, simply as a result of time. That physicians are often being pulled back to the office, and in a way that some midwives aren't. They get to stay with you. I don't know if that's still true. I will need you guys to talk about that, please. But there's a presence, there's a focus on bringing and honoring and knowing that women can have babies without all the technology and without all the intervention and without all of the fear mongering. Yeah.
Yeah, I want to say, in theory, we are with our women, patients, birthing people. It's not always possible. We are also called back to the office now. We're so busy. There is a lot of intervention. It's not quite always what we want it to be. We are not necessarily always able to provide that connected space throughout the birthing process, but we try and we do when we can. So it's a changing landscape for a lot of reasons.
Yeah.
Volume, morbidity,
Access, racial disparities, all the things that we're bearing witness to, right, in our country around morbidity and mortality in women and infants. Yeah, yeah. So the farm, Katie, I have to hark back to that because it's so, it's so clearly an extremely unique place. Does it still exist?
Yes.
Wow. How is that possible in the face of all that, Jenna just mentioned and all that we know that's impacting and interrupting birthing experiences in this country?
Yeah. Well, it was a very unique and strong movement when it began in the 60s. A group of women realized that birth experiences and care of women were not optimal at all for women, and they were so often bullied and taken advantage of and disrespected. And so they started an intentional community on this big plot of land in Tennessee, and they were many of them were of childbearing age, and many of them were pregnant, and they decided to teach themselves to become caregivers of each other. And they were very, very smart. And Ina May was one of the leaders of the group. And I think was able to instill this sense of women trusting themselves and their judgments and their awareness of their bodies and their knowledge. And that really helped create a lot of confidence. And they then could come together and help each other learn things. so it was over a period of time that they established this community, and there were other aspects of the community that were very interesting, but I'll stick to the birth part of it. So they had a very strong base for midwifery there that just continued to grow through the years. And the reason that I went there was because breech vaginal delivery is a hot topic. And
Very hot topic.
Just before I went there, so that it was 2006 that I was there. In 2000, I think it was, there was a term breech trial that was published and basically said that it's safer to have a cesarean. And so all of the guidelines used that study to develop their protocols and recommended that everybody have cesareans. And even for many years prior to that, any physicians were really losing any skills that they might have had to do safe vaginal breech births. And so I went there because Ina May had really specialized in breech vaginal birth. And by the time I went there, I was actually her 100th birth.
Whoa.
Delivery.
And I can tell you,
That's
just for those listening out there, most OBs, MDs, have never done that many vaginal breech deliveries. Even in the, if you will, 30 years ago in my training, there were a couple of clinicians who had that kind of experience. I mean, I don't even think they had that kind of experience.
Yeah.
And that's what it's kind of all about, is you learn the nuances of a vaginal breech delivery that does differ when, the head is coming first. And so it's wow, that's impressive. And Tennessee just kind of supports it, and
Well,
is there a constant fight around it?
I think there was a lot of challenges to get support for that, but Ina May and the group of farm midwives there really earned respect over the years. It was acknowledged how their outcomes were excellent.
Yeah.
And their care was phenomenal. And so they did have support, but I'm sure, I don't know the ins and outs of it, but I'm sure it was not easy.
So in the face of the American College saying prior to that year that breeches should be delivered by C-section, were you scared? Were you how did you emotionally feel around clearly choosing a place that was certainly offbeat and certainly not with the trend? Can you just speak a little bit about where you were emotionally around that choice?
Yeah, I definitely did a lot of research on my own. I read the term breech study as well as a lot of other things and talked to my midwife. I was planning a home birth in Connecticut and talked to my midwife there about the different options. And I talked to my mom, of course, and then it was suggested that I talk to Ina May. So I did, and I felt that it felt really clear to me that someone who's very experienced in the art of breech vaginal birth, and when the circumstances are all, in favor for that, the specific type of breech position, the baby being a reasonable size, pelvis expected to be adequate, all the things fell into place for me.
It's not just wishful thinking. What you're speaking about is the science, our understanding of the pelvis, the weight of the baby. So again, this is not just random, oh, I want to do a vaginal birth.
Right.
You were evaluated for it.
Yeah, and I, considered all the things. And I did find a doctor pretty close to me in Connecticut who was willing to do it and had done some over the years, but was not nearly as skilled as Ina May, I would say, but had done, had kept up his skills a little bit. And I went to meet with him, and he basically described the scene for me for my labor and birth would be me in the operating room with many, many residents watching, and that if even the slightest thing started to go wrong, they would go to a cesarean. So that seemed really scary.
Yeah.
And not at all something I wanted to do.
Yeah.
So I was appreciative that he was would consider doing it, but I did not want to do that. However, I did have him attempt a external cephalic version, so trying to turn the baby from the outside, which did not work. So I sort of tried all the things, and there are many other things, by the way, for listeners that you can do that are often successful for encouraging your baby to move into a head down position. So I did all those things. Even to the moment I went into labor, I was still swimming and doing handstands and somersaults in the water and laying upside down with my feet elevated and all the things.
Please, gravity.
But in the end, it all worked out for me. So I made the choice, I feel like, in a very educated and supported way, and I didn't feel scared. And I think part of it is I did trust my body and the choice that I made because I had had such great care to be able to feel that way. And so I went to the farm and I stayed there for a couple weeks, had my baby, and my partner was a veterinarian and was very comfortable with the natural process of birth and, had seen many animals in labor and usually they don't have anybody there with them.
Right.
It's just not needed.
Right.
And then so he observed that, even as I was before labor and then during labor, I just kind of moved around in the way that people move around and animals move around. And so I just had a really supportive environment to be having my baby and having a breech birth. And my mom was with me, and I think she was more kind of at my side when I was actually giving birth, and my partner was in a position more where he could see what was happening. And his comment, I remember, was that Ina May was a master of her craft.
Oh.
There were a few things that needed to happen that happened very quickly. And, myself shifting positions and taking very direct, clear instruction. And the birth was very, very safe. And the outcome was great.
I'm so glad for
Yeah.
you and your daughter.
Wonderful.
So you've mentioned that you had your babies before midwifery training.
Yes.
What about you, Jenna? Where did your kids come in that time frame?
I had been a midwife for 6 years.
Okay.
Yeah, when I had my first. Yes.
So let's just shift a little bit. And this is sometimes I personally have sometimes trouble articulating how I'm informed by my professional life into my personal life and how my personal life informs my professional life. Because after doing this for, 35, 36 years, they are so merged. I just don't have such a great capacity anymore to separate them. But if we could explore, and you both have such different perspectives because, again, Katie, you had your babies before you became a midwife, Jenna after. So can we speak about how being in this female body, we're all vulva havers. We all go by she and her. Is that correct?
Yes.
Yes.
And that how being in our bodies and then having those experiences, births, kind of affect the way you practice. And again, this is hard to articulate. I appreciate it. So let's start and try to encourage each other how to speak to it. Where would you go with that, Jenna?
I almost want to reverse the question.
Go
if
for it.
that's okay.
Please tell me.
I want to talk about how being a midwife affected my birth,
Mm-hmm.
right?
Yeah.
So I, with my first, I didn't know where I was going to have the baby. I didn't plan on a home birth. I didn't really know what I was going to do. And
How old were you?
36 when she was born.
And Katie, how old were you with your first?
26.
Okay. All right. So,
Yeah.
okay, great.
Yeah.
Keep going.
So, so a friend of mine who's a midwife said, why don't you have a home birth? And I said, I just don't want to deal with taking care of people who are taking care of me. If you're in my home, I want to take care of you. I couldn't, the beds and the towels, I just didn't feel like it. Felt too much. And
It kind of is.
well, for my personality type, it certainly was. And she said,
Let me stop pushing and clean up a little bit
yeah,
first.
just hold on a second. I just made a little bit of a splatter on the floor. Yeah, no. So my friend who was a home birth midwife of many, 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 many years said, come have your baby at my house. And I said, okay, that just sounds ideal. So when I went into labor, I was a little preterm, 2 days before 37 weeks, similar to you, Katie. And my water broke in the middle of the night. And my husband was leaving with his best friend for a concert way up north where there was no cell service. I think we had cell phones then. I don't know. It was a long time ago. And he was leaving at 6 a.m. At 3 a.m., I woke up and my belly hurt. And I said, oh, my belly's so hard. Mind you, I had been a midwife for 6 years, okay? 6 years. My belly is so hard. So weird. And then I was walking down the stairs to go to the bathroom and my water broke. And I said, well, what was that? Did I just pee? I've never peed before like that. You know, that's
I just had this great image of like how our brain compartmentalizes things.
Completely. Yeah. I still laugh to this day. So down and, why am I still peeing? Well, I'm just going to go back to bed. So I back to bed, tossing and turning. My stomach really hurts now. It's getting hard and it hurts. Oh, why am I so uncomfortable? So I get up and I start walking around and moaning and groaning and leaning on the counter and water's coming out. And my husband says, do you think you should call the midwife? And I said, what are you talking about? I feel like you're overreacting. And he said, I don't think I should leave. And I said, no, you probably shouldn't leave because I don't know what's going on here.
Right.
So I'm laboring around the house, absolutely in full-blown labor, an hour and 15 minutes away from my midwife's house.
Oh, my gracious.
And he said, I really think you should call her.
Mm-hmm.
And okay, fine. I called her to humor him. And she said, get down here now. You're in labor. And I said, what? Okay. So drove down, laboring in the car. And then I think in the car, I really realized I was in labor.
Yeah. Oh.
I mean,
It's called the placental effect. Our brain just goes to mush.
But what I love, and I guess that informs me as a provider, that we're so open in labor sometimes, we don't know what to expect. We don't know what it's going to bring. It helps me take care of women, pregnant women, birthing women, women who are not pregnant, that when you're in something, it's hard to see where you're at.
Absolutely.
And just to respect each individual's process.
Mm-hmm.
I mean, when I got to my midwife's house, my midwife and my doula were standing in the driveway with their hands on their hips, looking at me like I was a 5-year-old who had just, thrown something on the floor. Like, what were you thinking? And I just said, I don't know. What took you so long? Well, I'd had to pack my bags. I don't know. So I walked in her house, threw up all over the floor, and started pushing in about an hour. And just I was in this altered state. And so grateful for that.
Mm-hmm.
And I laugh at myself that I didn't know anything. As a midwife of 6 years, I didn't know anything at all. Yeah. And to be open to that, to our women who are in a process, birth, it could be anything that we think they took their birthing class, they're perfectly intelligent, but they're in a different space. And to honor that and support that is
I love that. Right? Because I asked the question about how our experiences inform us. And sometimes that information comes, in big, bold fonts that we read and know and understand and even apply to our experience. And then this experience of giving birth kind of just wipes all the letters off the page, right? Mm-hmm. And that it is so much about relinquishing and trusting. You use the word trust, that you knew that you trusted your body, you trusted your support community, and that's part of it too. Can you speak about that? Because for example, I always say that when women used to come to my office with single-space typed 4-page birthing plans, I'd say to myself, we need to work on giving up control here. Because,
when people bring their birthing plans to me, I say, absolutely, let's go through it together with one condition. We're going to go through everything, and then you're going to go home and burn it. You can print it out again. Don't worry. And I'll put it in your chart. Okay. I just want you to go home and burn it. To surrender. It's kind of a woo-woo word, but surrender to the unknown.
Yeah. Yeah. That's the trust, Katie.
That's the trust. Therein
Yeah.
comes the trust. Yeah.
So could you speak a little bit about how trusting your environment, how do you speak about that with your patients?
Well, going back to what you said about being, being on both sides of the speculum, it is one of the things that I really focus on. For me, having all my birth experiences and then becoming a midwife, I think it is a little different. I often struggle with how much to share about personal experiences. I really try to listen really carefully, and I'm very selective for when I share anything personally. It has to really seem to fit and have some way of improving the situation for the person that I'm with, and that is an art. And trust has to do with meaningful relationships, and for me that's at the heart of midwifery practice. Whether it's seeing somebody in the office for a prenatal visit and it's a very straightforward prenatal visit, so trying to connect in a way like, oh, what did you do this morning before you came in? Just building a little bit of rapport. Or, you seem kind of down, like having some time. And trust and time are intimately related.
Absolutely.
And one thing I definitely have to really give pushback on is protecting my time in the office with visits, or whether it's with women in labor, because that's really necessary to have those trusting relationships. But it's the trust with the relationship with the midwife and the care team, but also the trust for oneself. And so I think that it's also intimately connected. And I do see that women who can really surrender and really go deep when they are in the labor and birth process, usually come out with feeling the most empowerment. And that's empowerment really it's the buzzword with having a baby. It's because it's so clear that that's like, those are the stakes. Like you want the empowerment, and how much of it are you going to get from this experience? And the more you can trust yourself, the more empowerment you're going to get.
Right.
So it's something that we can facilitate as we're getting to know somebody, but also a lot of it is in the moment during the labor and birth.
And being open to that, of the twists and turns, literally and figuratively, that happen during the birthing process. And I want to point out, because I think we need to honor that, despite being open, surrendering, trusting, that sometimes shit happens. And in our world, I always used to say, when people ask me about giving up OB, I'd say, I miss it. I miss it a lot. But when things went wrong, it goes wrong. And so I want to say to women out there, families out there, that unfortunately, does it always work out? No. Is it always, is this an easy process? Easy is never a word I use around birthing. I don't care how much it follows the birthing curve and deliver vaginally and, no tear and all the things that we try to support and promote during birthing experiences, that things happen. And it's not because the woman isn't doing everything she possibly can, right?
True.
We need to speak to that.
Very, very true.
Yeah.
Yeah. And
because we feel so much guilt around this stuff.
Yes, yes.
Yeah.
And a lot of times women will be very upset if things don't go normally, if they end up with a cesarean section or there's a complication. And one can't really make sense of it often. You can, on paper, these are the reasons, but I say to them sometimes, look at nature. Things a lot of times work out well, but sometimes they don't.
Yeah.
It's part of nature for things to go sideways sometimes.
Yep.
And it's the human condition. It is very hard to come to terms with, but sometimes that helps make sense when things aren't, even like you said, with the surrender and the connectedness and all the, parts that we hope for. listen, plenty of people go through labor and birth with zero surrender and zero and whatever, anything that we're talking about here, and have a perfectly fabulous normal birth. And
Right.
so we have a lot of control and we have none simultaneously. And that concept spreads to our whole lives, obviously.
Indeed.
It's really,
Yeah.
comes up in GYN care as well.
Sure.
It's a deep, and I see it as spiritual process, not religious, but there's a lot of unknown.
Yeah. I mean, we're talking about faith, aren't we?
Yeah.
Yeah.
How we come in and how we go out of this world is not really in our hands.
Yeah. Yeah. So it unfortunately segues me to what we were talking about, Katie, vis-a-vis time. And again, far too often on GynoCurious, I'm talking about how all of us clinicians have been told we now have 10 minutes to spend with somebody, where the tempo of our day is so rapid and so frenetic, and where I know for myself, I feel such a sense of loss around the opportunity to be in relationship with my patients. And that's my favorite part of what I do. Not only kind of the artistry of how I am in connection with somebody on a one-to-one level, but also the building of that trust, the building of relationship, and then the teaching. Like, how do I build relationship, establish trust, teach, treat, send someone off understanding a little bit more than she came in with in 10 minutes? It's quite frankly impossible.
Right.
So I don't know about you ladies, but I'm chronically behind. I've learned how to be very articulate and try to bring all that in a very short span of time. But I know that our patients and we are suffering. So I guess I just want to speak a little bit about how you as individuals are coping with that pressure, how you create the moments where you get to tap into that love, that opportunity, that relationship that we're talking about. Because I know you do, because your patients adore you. So something's still happening there. But how do you cope as just on an individual level with this new medicine, or what they're calling new medicine or medical care?
Yeah. Well, I just want to say, having worked alongside you, Amy, I greatly admire how you keep the pace, and you always are attentive to what's happening around you and gracious and kind, and go through these days really with balance. And it's not just the every 10 minutes you're seeing a new person that is so challenging and just very hard in so many ways, but it's shifting from one person to the next. So not only are you seeing different people every 10 or 15 minutes, but you're having to prepare to go in to see each person and reset every 10 or 15 minutes. And it's just very hard and very, really just nobody should be in that position. And unfortunately, a lot of it is driven by just corporate expectations and finances. And I definitely, as I mentioned, have had to myself and with other midwives push back a little bit on the amount of time that we have for visits in the office. I have had schedules at various times in my career that are way too much to manage. So whether it's, lots of prenatal visits and then interspersed with complicated GYN cases.
That's
and
right. You're doing
that I
that
might
too.
run down the hall and say, Amy, I need to ask you about this. And so that is a huge problem, I think, all nationwide. However, I currently feel like I always wish I had more time, but in various points in my career, I have had to see 20-something people a day. And at other points, I've not had as much pressure, and it makes a huge difference.
Yeah.
And also, I do have the opportunity to have as long a visit I want when I have somebody on a triage at the birth center. So there's other ways. And also, the more often that I can do my own callbacks to discuss results or plans, that's always very appreciated by patients and a great way to develop communication and rapport. So,
Yeah, Jenna?
Well, in the past, when I was in private practice, I allotted an hour and a half for each patient.
Wow.
And I was just doing GYN care at that time. And felt very luxurious. Had a great exam table, designed it all the way I wanted to make women feel comfortable and attempt to meet all their needs. Now it's different. I work in a big organization, and there are time allotments. I am lucky to have some control over my schedule. One of the ways that I address the problem of time with my patients is to be very open about it. Say, listen, we have this little nugget of time. Let's get to it, and we focus together. And if I feel like I can't meet their needs in that time, I will say, one, come back, and if it feels more urgent and there's no opening in my schedule, I go up to the front desk and get them in so they don't feel like they're left out there in the wind. I let them know how to connect with me directly. So I do go out of my way to try to create a cushioned space around each visit. Getting through the day, you just do, like Katie said, you have to reset, and it becomes an automatic. You just have to click the button, reset, and do it again. And I think it's my love of what I do that drives my vital force through the day. And yeah, the goal is always to listen, and then get right to the heart of it. And again, if I can't address every single thing, which I want to, but sometimes is impossible, come back again. We'll get to it. We're going to get to everything. We're going to get to the bottom of this. And, I know when I go to my GYN, I have, maybe 20 things I want to talk about. And I want a couple hours to address everything really thoroughly. And for some women, they don't. Fine. But I can see that women have, waited for this appointment for 3 to 6 months, and they have a list of things, and I am absolutely committed and determined to get to every single one of those. And how we do it, follow-up telemedicine, messaging, it's a process, but it's not easy. And it is, we have a lot of time constraints, and seeing 20 to 24 people a day is, it's a challenge.
Yeah. Somebody was asking me to give a kind of metaphor for this challenge the other day, and I had to think. And the one I came up with, and I don't know if this is going to speak to you both, but I was describing how when you're in a pool and you're in the shallow end and you go to dive, and then you go to the high diving board and you dive in or jump in and you go deeper into the deep end. And I said, you know what I've learned how to do? I know how to dive in the shallow end, and I know now how to dive in the deep end really quickly. Like, I dive deep really quickly. And I don't know, as you pointed out, Jenna, I don't always have to. Sometimes people don't have anything they really want to talk about. They just want their pap smear, they need a breast exam, they need their mammogram script, and we serve that function, and with great heart, I'm glad to do that. But so often it's not quite so straightforward, and particularly if you're listening, as you describe, that all of us have complexities in our lives, and often women don't have places to share those complexities. And there's something about the nature of GYN exams and the birthing experience that just, at least in my experience, just it does eventually help women open up and that there's an acceptance that, hey, you're looking at my vagina, I guess I can tell you about the intricacies of my love life too. Or, it's not true in every GYN exam, but or GYN environment. Again, clinicians aren't always interested in diving off the deep or the high dive like I do. But yeah, there's just an opportunity there. Yeah.
There's also, I do like the analogy, and I really get it about the shallow and deep dives. And I think being able to do both and know like instantly when you need to do which.
Yeah, exactly. Well put.
And also like what it takes to do that all day, of like if you jumped in the water 25, 30 times a day in and out of the day, like that's how exhausting and trying it is on us as we move through the day.
Yeah.
But also I think a lot of it for me is having a quality with your energy and reading the room when you go in, eye contact, awareness, that goes a long way when you're with somebody.
Absolutely. Put that computer down. Mm-hmm. Yep.
Yeah.
Yeah.
So even if you don't have an hour and a half, Jenna, to listen to all your 20 things, you still instantly show respect and interest, and even if it's for 10 minutes, it is recognized, and it does build a trusting long-term relationship that's really valuable in healthcare
for all of us,
Yeah.
as the clinicians, as patients, both. Absolutely. And it's such a beautiful exchange when it works well. And, again, for those listening, we don't all have options as to who we can choose to be our care providers, whether it's about the lack of clinicians in your area or your insurance company, access, all kinds of things can be obstacles along the way. But one, if you have a choice, choose someone who looks you in the eye, who speaks to you in a language that you understand, that attends to your needs. And, can everyone fill everybody's needs? Of course not. But you can write your list down. You can have those questions ready. And again, if you can have your practitioner say, I'm sorry, I don't have time to address all these things today, but I want you to come back, or I want to make sure that we address these things because they're important. Validating you is so important. And I'm often telling listeners, you have to advocate for yourself, because again, in the world of medicine, as it changes, as it shifts, as the constraints are placed on the patient, the practitioner, the organization, our country, that we have to be able to stand firm in our needs and speak to them out loud. And are they always addressed? No, they're not. They're just not. And so my hope for this country is that we figure out some shift in the way we provide care, because it's hurting all of us. Yeah. Yeah. There's a lot that we've covered. We've kind of been in the shallow end in some of these conversations and deeper end in other parts. Ladies, is there anything that you want to bring into this conversation as we come to, a close, that you feel is important that we just say out loud, whether we're a patient, whether we're a midwife, whether we're a clinician, that you just feel is important to share?
I do want to say, to remind listeners, that midwives provide care throughout your life. Some of my patients are 10 years old and some of them are 99 years old. Mm-hmm. And we can be with you through your lifetime. Midwife means with woman through the whole lifespan. So we take care of you all the way through. And while birthing is a very special and unique thing, the connection that you have with your midwife isn't that different when you're there for your annual exam than when you're there for your birth. It's at least that's my goal as a provider, to be fully present to all of my people, patients, clients.
Right.
Yeah.
Right.
Yeah.
Yeah. Thank you. Katie?
Yeah. Well, Jenna, that was very well put. I also would just add that midwives are like any of the rest of you out there, and we have our ups and downs. And I talked about a couple of mine with birth. I also had tremendous loss with one of mine, and that it's really important to, in whatever ways you need to have education about what you're going through and support. There's a lot of ways to get support. And so I just encourage people to reach out, and midwives and hopefully all care providers can help connect people with different services and different things that they might need in their lives. It's not just going to your OBGYN for that exam. It's a lot more than that.
Thank you for sharing that.
Yeah.
And I think particularly in today's world on social media, where the kind of the celebration of all that's positive and the gender revealing parties, et cetera, that there's a tremendous amount of hype around kind of just the positive, and that there isn't enough, quite frankly, open conversation about the shadows and the losses and the grief. And that, again, part of the storytelling that we've had this morning, our own stories, is these are nuanced. They're easy and hard. They're human experiences that need to be told. And again, I think that's what women are so great at doing, is sharing our stories, empathizing, sympathizing, asking questions of one another. So surround yourself out there with women who are willing to share their lives with you. And even if it's just a little bit, you're going to collect, you're collecting snippets along the way, and that's going to help you know more. And knowledge, I know, is empowerment. And knowledge is what helps us grow. And that we're all trying to just do the best that we can. Yeah. Thank you to both of you for sharing your stories with us this morning, for being so open and honest about the beauty and the challenges of your career and your personal experiences. I want to thank Matty Rosenberg and Jen Hammoud, the producers of this show, and to the Epicurean for providing this lovely space that allows us to record each week. Until our next conversation, please stay as healthy as you can. Remember to relish your instincts and intuitions. They are the greatest of teachers, never to be ignored.